Yes, good afternoon, everyone. This is Faisal. I'm based in New York City and I've had a long association with Silicon Valley in California. Um, at this point in time, I am working at a private equity fund called Fraser Healthcare Partners. We are a 30-some-year-old private equity fund primarily focused on healthcare and healthcare services, which is kind of our claim to fame. So we do not invest in any other sector and specialize in healthcare. As part of that business, we look at companies that have achieved market uh, product market fit and are becoming profitable and are looking for additional investment from people like us with deep healthcare expertise and relationships in the customer base to double or triple their revenue and profitability. Some of the investments that we've made are in the software and services companies that focus on health plans, um, type of companies that focus on health plans. We've also made investments in companies that sell into pharmaceutical sector, such as uh, Pharmaceutical Hub, which is a software platform. And then we've also invested in companies that are focused on healthcare providers, such as clinics, hospitals, post-acute services, which is hospice and palliative care. So, as you all know, healthcare is a very, very, very large sector. And what one person means by healthcare is very different from what other person means healthcare. So for some people, healthcare is all about drugs and new medications. For others, healthcare is all about devices such as, pacemakers, etc. But for us, healthcare means services that are used by healthcare providers, services that are used by patients, such as billing, payments, claims, scheduling, etc. So we are focused in that sector. I particularly have been with Fraser for the last 2.5 years,
Mm-hmm.
focused on uh, helping them buy companies that are in the patient and provider side of the market. Um, Two of the companies that I sit on the board of, one is called Vatica Health, which does health plan risk adjustment, which is an extremely large, very complicated, but very profitable business market for health plans. And then the other company I sit on is called RevSpring, which is the largest billing company in healthcare, where for those of you who have encountered the US healthcare system, you know that you get a bill every time you go see a physician, and
Mm-hmm.
then they give you an opportunity to pay the bill online. So RevSpring is a company that is the company behind sending you that paper bill and or reminding you via text messages to pay
I
your
see.
bill. And then when you go online to pay the bill, we are the company that's behind that payment infrastructure. So um, healthcare has a very, very large underbelly of things that people don't see, but it costs a lot of money for healthcare providers to provide those services. So we
Right.
operate in that administrative side of healthcare. So with that, I'll give it back over to you, Sarosh.
Sure. Thank you so much for such an amazing introduction. And I'm like, uh, it's hard to see where should I start. So basically, you mentioned that you are now in the private equity side. Have you always been, was it something that's in your mind that I want to start, or maybe you have maneuvered yourself from, let's say, enterprise, and then, slowly, but you're like figure out, okay, this is the direction that I want to go to?
So there are two
Private
ways to
equity.
get into, yeah, there are two ways to
Okay.
get into health, private equity. And for those of us, I never thought I would be working in private equity. So
Okay.
with that out of the way,
Mm-hmm.
um, there are two ways to get into private equity if people are aspiring to do that. One is you go to a really, really top MBA school, such as, for example, everybody in the firm that I work in, they are either a Harvard Business School graduate or a Columbia graduate. That's it. They don't even interview anywhere else, which in itself, I don't agree with it, but it is what it is. So that's one way to get into private equity. And the other way to get into private equity is just you have spent your entire life in healthcare, and you can't learn what I've learned over the last 35 years by doing an MBA. Right. So what are the trends in healthcare? Who's buying what will work, what doesn't work? Things that are not visible in a spreadsheet. So people who are experts in healthcare because they have worked in healthcare for a long time, that's another way to get into healthcare, because these two groups of people, one who are really smart MBA type people who have done really incredible things in their careers, they partner up with people who have done a lot of healthcare work itself. Together, they create, the meaningful value in private equity. So like I said, there are two ways to get into private equity. I never thought I would be doing this because you just don't start your career saying one of these days after 35 years, I want to work in private equity.
Right.
But the opportunities come, and you take what
throws to your way.
Makes sense. Yeah.
Great. Amazing. So what do you, in your perspective, how can you tell me how can you successfully scale, the healthcare technology companies in your experience?
So
what kind of notes you should give?
Yeah. So there are things that I think are important to understand. For example, as an entrepreneur, this is an entrepreneurship type of an organization.
Absolutely.
So there are people who really want to start something from the ground up. And there's you can go raise seed money, you can go to VCs, etc. So we are kind of the third step. We are not the first step, we're not the second step, because the companies we look at are already one of the 100 company that has survived, right?
Okay.
So as people have said, right, for every 100 companies started, only one will survive. So one that survives and scales, they end up becoming successful to a point where private equity becomes interested in them. So companies that are growing very substantially are never a candidate for private equity, because we come in when the growth has settled on 20-30% per year rather than 100-1,000% per year. So a lot of value has already been created in one of those 1,000 companies. And now when you get to 100 million revenue, or you get to a $400 million revenue, then the type of people you need, the type of skills you need, the type of market presence you need changes, because growing 30%, growing a $400 million company 30% is a very different challenge than growing a $4 million company 30%. Because for us, an average contract size is several million dollars. So winning those large contracts require a different kind of skill set. It requires a different kind of company structure. So that's where private equity comes in, is to help entrepreneurs and executive teams learn those skills, augment those skills. We bring in people. So for example, some of my other colleagues, as an example, who do the same thing I do at Fraser, one was the president of Cleveland Clinic. I'm sure you've heard of that. It's one of the largest healthcare provider in the country. So he was managing 125,000 people in his last job. And he knows everybody who's anybody. Another of my colleagues was running a $4 billion corporation, selling billing solutions to some of the largest hospitals such as HCA, Stanford Medical, etc. So you get into these phase where you are not growing at as a rocket ship, but the numbers become really big, and that's where we come in. We help companies and management teams scale when you are really big, 100, 200,
Mm.
$400 million. And in order to grow, you need a lot of capital. It's no longer 10, 20, 30, $50 million. I mean, in one company, we just put in $400 million as a working capital, because that's
Wow.
kind of the scale you need
No.
to grow these companies. So purely from that perspective, we come in at the third stage of a company growth.
Okay.
So for every 100 companies, let's say for every 100 entrepreneurs, one entrepreneur survives the initial, and for then
Initial stage.
and then for every 100 of those, 10 become $100 million, and we kind of
Wow.
come in at that stage, right,
Okay.
where we are helping them really become massive corporations.
Right. That's amazing. I mean, I need some time to first figure out the numbers and then put them together and, put them into perspective. It's just like, but this is amazing. And I'm really hoping that people who are in this field, they are really getting notes and really getting prepared for meeting you in an unscripted, because this is the main purpose of this pre-meet, that not everything, like you said, can be just put down into your LinkedIn profile and what have you, right? So once they got to know, like, okay, this is the domain that you have worked in, I'm sure that they're gonna have come prepared with lots of particular questions that they would be interested in. So,
Right.
for me, I would say honestly, we were able to just put some very generic, general questions, because so that we cater from every dimension. So, what I want to ask you, you've mentioned that healthcare has several domains, from equipment to services and to drugs and all that kind of thing. You are in the services side. Um, uh, I mean, I'm sure that it's probably not as customer or patient centric, but what do you think were the challenges have been, or the opportunities for companies like this to be more connected and patient centric, if that makes
Right.
sense? Yeah.
Right. No, that's a really good question. So, services is the one thing when you go to a healthcare provider,
Right.
that is the one thing you experience.
Yeah.
The nurse sitting at the front, the receptionist,
Mm-hmm.
your bill is getting, it's wrong, or, they give you the wrong prescription, or you go to CVS and the drug is, you know, can't be reimbursed. All of that is considered,
The
services,
services. Yep.
right? So we are kind of the day-to-day of healthcare.
Okay.
Short of saying, somebody has a specific disease, we are
Right.
kind of in the everywhere world. Um, so for us, we lose customer if we are doing things that are not focused on the patient. So we are,
Got it.
some would consider that we are probably the closest to a patient on a day-to-day basis. And that's where the exciting part is, because if you are in our part of the world, what's working and what's not working.
Hmm.
So for example, when healthcare changed from all paid by health plan to a co-pay plan, where, if you all remember 20 years ago, when I would go to a doctor, I probably paid no copay. I had no copay, zero copay. I would just
Okay.
go see a doctor, pay zero, and come back. Now that's a novelty. It doesn't exist. You have to pay $30, $50,
Yeah.
$70, because
Yeah.
they're moving, employers and government is moving some of the burden over to the patient.
Right.
And what's happening is that one thing we don't realize is, when you move that burden to patient, you're actually not moving that burden to patient. You're moving that burden to the doctor, because many
Interesting.
times the patients don't pay. And so it's
Okay.
growing the bad debt of the doctor. And the doctor is not a billionaire. He or she can't have, $100,000 sitting in accounts receivable from these patients.
Hmm.
So there are lots of technologies that are coming, which is now allowing the doctor to refuse service when they can see that last time you saw them, you didn't pay the copay,
Oh, interesting. Okay.
right? Because that is one of the fastest growing problem in healthcare is people
Right.
not paying their copay. And if the
Wow.
doctor doesn't know that you were there last time and you didn't pay
Right.
your $100, I
Yeah,
mean, she will keep seeing you. So the front
that
office
makes sense.
needs
Yeah,
that technology to know that
I
you didn't
see.
pay and or you are a very difficult patient and they don't want to see you. And there's no law that requires the doctor to see you. They can refuse service if you
Interesting.
don't pay. So when I think about, so we are kind of at the forefront of seeing what's happening in healthcare and what are the real issues that are hurting the business of healthcare,
Hmm.
right? I mean,
Okay.
clearly, people who are in the drug research business, they know what diseases are being treated or not. But on a daily basis, we see what's hurting the patient, we see what's hurting the provider, and we see where the opportunities are for the health plans to become an important part of the delivery system.
Interesting. So
Yes.
you have really nailed down the challenges with which, it comes between the doctor and patient. So there were the real life challenges, and
Yeah.
you guys jumped in and, figured this out. That's
Yeah.
amazing.
Yeah.
That's
So
cool.
the reason I'm
Yeah.
bringing this up is,
Hmm.
as you think about the forum itself is, you know, entrepreneurs have a really incredible opportunity to understand the real issues in healthcare, um, and then think about the new solutions that they can create. Because if you know what's happening today on the ground,
Hmm.
then you can be one of those 100 people that can start a company that will be really successful. Unfortunately, in healthcare, in the seed level, seed round, and um, in the VC round, a lot of the companies VC founded are not really designed to solve a real problem. They're designed to solve a technology problem. And we see a lot of companies that we believe will never succeed because they are not working on a patient problem. They are working on a super cool, super exciting technology problem. And we have learned a long time ago that technology doesn't pay the bills. It's the people whose problem you're solving will pay the bill.
Hmm.
So I get really excited when I get the opportunity to talk to, the open SV is, these are the people who will actually create the companies that will one day be successful, that we as a private equity people will look at it. And I think, I am on the board of my University of Wisconsin and Madison. And that's the message I take to the students also who are graduating every semester from the computer science program.
Hmm.
That there are very, very big and cool problems to solve in healthcare. Um, going to Google, going to OpenAI, etc., is obviously a cool thing to do. But we need some of the smartest people in who are students right now or graduating to be thinking about healthcare problems,
Healthcare.
because that is where, every time you see the unemployment report or the employment report or the job creation report that's issued by the government, you see that the most of the jobs are being created in healthcare. And
Oh, okay.
you cannot outsource healthcare. You cannot, quote unquote, completely AI healthcare. I don't know about
Yeah.
you guys, but I don't think I'm going to let a machine diagnose me.
Yeah.
I would love for a machine to
Have a
help a
human.
doctor.
Yeah.
I mean, I would love a machine to to help the human make that decision, but I'm not
Right.
going to sit in on the other side and the machine saying, Faisal, you have this problem. I was like, no, I'm not talking to this thing.
Let me operate you.
Right. So
Yeah.
this is one of
Okay.
those things you cannot outsource to India.
Yeah, absolutely.
This is one of those things that you need humans.
Humans,
Even this
for sure.
last quarter, when the job report came out, I think the US added like 40,000 jobs, which is one of very, very low number. Even in that low number, more than half were in healthcare. So this part of the US economy is going to continue to grow. It's going to continue to explode. And when I think about my kids and other young people, I really encourage them to think about healthcare as the next safe market to go innovate, the next safe market to feel like there will be some consistency, etc. And that's why, my mission is being, even at the University of Wisconsin, is the same thing, is to encourage kids to think about careers, encourage them to learn about healthcare so they can create new businesses in healthcare.
Right.
That's amazing. Yeah, go ahead, Tahir. You want to have some
Yeah,
questions?
so with the rise of AI, just piggybacking off what you just said, with the rise of AI, where do you believe the most meaningful applications will be in healthcare over the next, 5, 10, 15 years?
So there will be an impact of AI in every part of healthcare. So let me start at the top. So when it comes to drug discovery, it's disrupting drug discovery. Because the way drug discovery works is they look at a disease and then they have a list of candidate molecules that they think about and say, well, this drug can treat Alzheimer's, or this molecule. And then they will spend 5 years just looking at different molecules to identify which one has the highest potential. Now with AI, that universe of 50 molecules is going down to 5. The work is not getting reduced. The candidate list is shrinking really fast.
Right.
So I think we'll see more drug treatments coming out much faster. So it's a materially faster cycle of drug development. So it's going to be very disruptive. The science will not go away. The science will become super fast. When it comes to the clinical side, which is when you go see a doctor, you're seeing a lot of places, and it's going to become bigger and bigger, is the doctors will be augmented by the AI software that's available on their desktop. So one of the simple example I can use is, I go see a doctor. Let's say I have a flu symptom. I'm going to see a doctor, and the doctor is looking at my flu and giving me some simple medication. What's happening already is the doctor is then alerted that Faisal is a very strong candidate for colon cancer. Even though I did not go there to talk about my colon cancer, but looking at my history and the last blood test and all that stuff that the doctor has no time to look at. Because, she's very focused on my flu. I'm sneezing, I'm throwing up at her. She doesn't have time to think about it. And a doctor on an average day, you guys may be surprised, sees 34 patients on an average a day. So you're no more than a number. So what AI is starting to do is starting to help diagnose diseases, or at least ask the doctor to look into it, so that you can be treating undiscovered things or emerging threats to your health without the doctor having to go sit and think through everything. So that's another area where it's happening really, really fast, and I think it's for the better. The third area where some of you may know this already is, for every $100 that is spent in healthcare, $26 is spent on paperwork. So it's not spent on doctor's salary, it's not spent on lab, testing, it's not spent on MRI, it's spent on paperwork. And a lot of these paperwork is starting to get automated. So it doesn't mean that your healthcare cost will go down by 26%. It just means that more money will be available when more drugs will come on the market. So AI is going to change that materially. And coming back to my earlier comment, unless we have smart people thinking about these problems, it's not going to get better. And therefore, I really truly believe that we need the Silicon Valley smart people thinking and working on these problems. Yes, we need more LLMs. Yes, we need more smarter way to put advertising in websites. But this is an extremely difficult problem that we need smart people to be working on.
Right. Well, I think that is all the time we have right now. I think it's half an hour. We really appreciate having you here, and on behalf of Open Silicon Valley, we appreciate your time and your insight on this short but very, very meaningful webinar. We also appreciate all the attendees that joined. Thank you for taking time out of your Saturday and coming to our webinar. And we have a few more coming up with different panelists, so hopefully we see you there as well. Anything to add, Sarosh?
No, I mean, yeah, like I said, unfortunately, the time has ended. Maybe we should have like made it for like a 1 hour, because once you start talking, like I was having all the list of questions and I'm like, okay, I'm gonna ask at the end, but unfortunately, time didn't permit. So, that being said, I would love you to, of course, have people maybe come up with the list of questions, and then and during that 1.5 hour or 2 hours that we'll be spending on Unscripted, that will be the time for them to really sit down and talk to you in more detail. So we really appreciate you taking the time out from your busy schedule today, and of course on the day of the forum. So we are really looking forward to meet you, Mr. Mushtaq, and thank you so much again for your time.
All right, you're welcome. Appreciate everybody's
you.
time today. Take care.
Thanks. Bye-bye.
All right, bye.